Hi, I'm Tamika, story collector with Florida Voices for Health. I've had a great privilege over the last few months to talk with Floridians from Escambia County down to the Keys, people who are uninsured and need to see a doctor and can't. Talk to people who are underinsured and afraid that one trip to the hospital or to the ER could bankrupt them. The stories are heartbreaking, I can tell you that. They leave you wanting to run to the highest hill and scream to our legislators, hey, we've left some people behind here. And trust me when I tell you, they feel left behind. Every day they feel left out and overlooked and ignored. And so I want to take this opportunity to say thank you to our storytellers. Thank you for entrusting us at Florida Voices for Health with your story. Thank you for allowing us to amplify your story so that it's heard beyond even our state. Stories unite us, and so we are invested in telling the stories of Floridians so that we can have change in our communities. Thank you.
My name is Sarah. I've worked in healthcare for almost 20 years. I started off as an EMT and I'm a medical assistant now. And for me, health insurance is just something that I can't afford. Currently, I do work 7 days a week. That is being impacted by the coronavirus. My part-time job doesn't have me coming in for that due to the lack of necessity for more employees at the moment. So I don't have all the income that I normally have. But even when I do, I can't afford health insurance. Health insurance is something that I don't have, but I could really use because I have chronic conditions like asthma and chronic migraine. I know that I have had more migraines just recently. I'm not really sure, what exactly that is since I can't really follow with a neurologist, but I know over the past week, I've had more migraines during the last week than I've had in a really long time. So it may be, stress induced because I am losing income. I'm losing a partial income. That's a Saturday and Sunday job for me. Not being able to apply for Medicaid or Medicare and be approved for that because I work so much, because I'm outside of what they consider a poverty level. But if I don't work so much, I also then can't pay my own bills. So that's something, there's no middle ground to this. There is either you make so much money you can afford healthcare and everything's really great, or you make so little that you're in poverty level and the state will financially help you with insurance. For me, I'm right in that middle where I make too much for any help, but I don't make enough to actually be able to afford it. So for me, there's no middle ground. I looked at the marketplace. The marketplace had a really high deductible, and then also the monthly payment was really high and something I wouldn't be able to put out there with what I have now. So that's not even an option. For me, having a migraine, if I take all my medicines at home and then I have to go to the ER, that could really devastate me financially because I don't have insurance and I also don't have the money to be able to save to afford something like that, to go to the ER and be able to pay those doctor bills and come out okay from that. So there's nothing that for someone like myself, there's nothing that where you can work, you can be a hardworking citizen, you can pay for your, monthly bills on time, but insurance is the problem for me. Expansion is important for persons like myself. Again, I work for doctors. Just talking around my office, I'm not the only one, unfortunately. Everyone's around the same pay scale. And of course, we don't really get into too many details. But the point is, none of us have health insurance. It's really good if this expansion was able to happen because you have hardworking people who have gone to college, who have degrees, who are in jobs that require special training, like the job that I'm in, but still can't have health insurance because while I'm not making, minimum wage, I'm still not making enough. And I think that that's important that we get that gap filled where, look, we see that you're putting this in, you have a college degree, this is a skilled trade, you are doing something that you could not do without having gone to school or without additional resources or training. But here's the one thing you're lacking, and here's how we can help you with that. That's important because I'm not the only one. And it's important that we get everybody a chance at healthcare.
When the Affordable Care Act first went into effect, I was trained and hired as a navigator, and what I did was help people apply for health insurance through the marketplace. Many of the people that I met didn't qualify for any financial assistance to help them pay for their health insurance, so they did fall into that Medicaid gap. Essentially, they couldn't, qualify for Medicaid because Florida chose not to expand Medicaid here. So we failed a lot of people in this state, and I worked as a navigator for 2 years before joining another company that, paid for me to be able to get my health insurance license as an agent. So today I'm actually a small business owner. And, I find that people often have a misconception about the type of person that doesn't have health insurance. Many would find it strange that I am employed. In fact, I have my own business, but there were times in the past where I didn't even have health insurance. So I know firsthand the benefits of having health insurance coverage, but my income, fluctuates being a small business owner, and I was just brand new and stepping out there. So there have been months where I couldn't afford my monthly premium, and I've been on that side where you work your heart out, you do your best to make an income, but you still can't afford to, pay those monthly premiums. So you let things go. So when I had been without coverage, I would often visit the local community health center when I was sick and not feeling well. They actually have a sliding scale, which they, based on your household size and your income, it makes it more affordable for you to be able to see a doctor. But when I wasn't able to afford that even, a lot of times I would just ignore pains and aches that I was feeling. And, sometimes I actually ended up having to go to the emergency room. Having been on both sides of the healthcare scale, I can clearly see that we do have a need for change. And I'm happy that the ACA and tax credits are helping people, but there's still a lot of people who are falling into that gap and they're not getting the coverage that they need. There's a lot of people that don't have coverage. So even with the advanced premium tax credits, they're still missing some people. So if we had that expansion, that would provide access to a lot more people here to be able to have access to the healthcare that they need. This past open enrollment, and I like some of the people that I met at the healthcare kiosk, a lot of people that I ended up talking to, some of them were falling into that gap. It's kind of heartbreaking to, you sit there with them, you go through this application, they think that they're going to get something and they fall into that gap, and it's like,
I'm Dr. Kaiser Anna King. I'm an anesthesiologist at the University of Florida. I've been in that position for almost 30 years. It's hard to think of somebody who's had one job the whole time. And over my lifetime, I have watched our healthcare system get more and more fragmented and have watched it become more and more difficult for patients to access good healthcare. As an anesthesiologist, I oftentimes see patients sort of at the end of a journey to actually come to the operating room. And so I oftentimes see that struggle that patients have for getting health care. It wasn't that long ago that I was assigned to take care of a room where we had 3 patients who were going to have breast cancer surgery in one day. The first patient was a young lady who had a very small biopsy. She had good insurance. It had been caught early. It was, she was in and out of there as a day stay patient. The next one was an older lady who had Medicare, and she had also gotten her mammogram done through Medicare. And she had a little bit bigger operation, but was in the hospital for just one night, because again, her disease had been caught at a very early stage. But the last patient that we took care of that day just broke my heart. She had to come in through our emergency room, and she had what we call a fungating lesion coming from her breast. That means that the cancer had broken through her skin and had created a weeping mess in her breast. So she'd had to be admitted to the hospital. She'd gotten antibiotics for 2 days before she came to the operating room and had to have the entire breast taken off. She ended up in the hospital for about 4 days after surgery, and all of that was because she couldn't get a mammogram. She could not get access to health care short of coming to the emergency room when she had a real emergency. Most heartbreaking is that her prognosis will be severely impacted by that. So her likelihood of being alive a year afterwards was determined only by the fact that she didn't have access to health care. At this point in time, there's just absolutely no excuse for us not to do this. If you can't afford to see a doctor, you can't afford to have a mammogram ordered, you can't afford to have your blood sugar tested, you can't afford to have an EKG done. We have almost 1 million people in the state of Florida that are either underinsured or have no insurance at all and have no hope of getting insurance. So we call those people that they are in the gap. So they make too much money to be strictly given Medicaid, and they don't make enough money to qualify for the Affordable Care Act marketplaces. They have no hope of gaining access to medical care. And those are the patients that I truly feel somebody must stand up and advocate for. 70% of those people work. They are people you see every day. They work hard, they take care of their family, and they are just one $500 bill away from disaster. And it shouldn't be for getting medical care. Physicians have a unique place in our society. They are trusted. They all have a scientific background, and they are all frustrated. They are frustrated by their inability to fix all of the things around healthcare that make their patients unhealthy. The lack of access to medical care because of a thing like lack of insurance, because Medicaid hasn't been expanded, seems like something we should be able to own. We see the outcomes on a daily basis. We feel it when we take care of patients. And we should be able to and must stand up and take a stance on this, because this isn't about dollars and cents. This is about people. And this is about making sure that people have access to health care. I will say, on the flip side, it is about dollars and cents. And it makes every bit of fiscal sense for Florida to expand Medicaid. On every state that has expanded Medicaid, they've had a positive economic impact. Let that kind of roll around in your head just a little bit. Every state that has expanded Medicaid has had a positive economic impact. There's not a debate about whether Medicaid expansion works. Virtually every medical and economic outcome that you look at favor those states where Medicaid has been expanded. And if you're one of those people that thinks Medicaid expansion doesn't really impact you, let me just tell you, if you have insurance, that your premiums go down by 7% when a state passes Medicaid expansion. So the moral high road, the fiscal high road, the right thing to do, the medical high road, is that we must expand Medicaid.
Six or 7 years ago, my appendix perforated, which is a lot different than having it burst. So unbeknownst to me, I was walking around with poison going through my body. And then I was working full time at the time, and I got up one Sunday morning to go to work, and my whole side had blown up. So we ended up in Naples, in a hospital in Naples. At that time, I don't remember really anything. I just know that I was septic, and poison was all through my body. The next thing I remember was I had all these drains out of my belly, like all the poison was coming out of my belly. But for a month, I was in and out of consciousness because I was really that sick, and ended up, long story short, having a surgery which took most of my colon and part of my intestines. Unfortunately, I didn't have health care. So I believe that I got the care that I needed, but if I had Blue Cross Blue Shield, I would have had better care. That's just my opinion. So I went back to work, and I did pretty well for like 6 years or so ago. I did apply for disability though, because I knew I was compromised, and I knew I was going to have a hard time really giving somebody 100% of myself in a job. So I went through the process. It took like 3 years, and ended up going into court. And in court, I, I got a letter from the judge stating that I wasn't disabled, that I could do certain jobs. And one was cleaning. So I joined a cleaning team here in Palmetto, where I live, and they fired me within 3 months. I just couldn't keep up. Regularly like 120, 115, 120 in weight, and I was down to 92 pounds. So they fired me. And I understand, like, I couldn't keep up. It wasn't worth them keeping me. I totally got it. So I figured I'll try retail. That was the next thing the judge said I could do. So I went into retail right after that. And then Thanksgiving started getting really busy, the holidays, and they would put me on longer shifts. So I was doing 8 to 10 hour shifts and sometimes not getting a break. And right before Christmas, I did a 10-hour shift without a break, starving, ate a bag of popcorn, not even thinking that it would make me sick. And the kernels got stuck in my intestines. And I ended up within a couple of days in the hospital with diverticulitis. That's how this all started, with the diverticulitis. And they did a surgery. They got that like cleaned up a little bit, but I wasn't able to really be like 100% me, like working and being vivacious and outgoing and sales oriented, like the person that I am. I ended up going back to work in November for a little bit of time. And then in December, I got really sick again. And that's when I ended up with the colostomy bag. And that was the beginning of hell, let me tell you. Again, I was in the hospital for over a month, and I was treated very well. I have to say, nurses were wonderful. They were very nice, but not having the proper insurance, they don't keep you. As soon as they're done with you, you go home. And most people that go through what I've gone through would have got a home health nurse, someone that helped me transition from hospital to home with especially this kind of a wound. My husband and I tried, like, we blew out probably 6 or 7 bags, like just trying to figure the whole thing out. I belong to a lot of online support groups. And one lady in Maine, she had some extra supplies, and just for shipping, she was going to send them to me, because just to pay for my supplies is about $300 a month. So nice as she was, for $10, I got probably a month's worth of supplies. Wasn't my brand, it wasn't what I was used to, so I had to kind of use masking tape and medical tape, but it worked. And like, there's a lot of people in a lot worse shape than me, and I'm not complaining. I really am not. I'm very grateful for the people that have helped me. I just want to help other people in the process. It was really, I'm going to cry. It was really difficult for my husband and I to try to figure it out since January, because I'll catch anything. I'll catch anything from anybody, so I don't leave. Going back to it, he's on Social Security. He's disabled as well, but he took a part-time job just to get ends meet. Like, it's at Dollar General for $9 an hour. The man's a professional. He made much more than that as a man, as a profession. But just for us to get by, he knew we had to do something. So yes, I'm a college graduate. Yes, I do have a degree, but that doesn't mean I can't get sick. I was a social worker by trade. My degree's in human services. That's what I did for work. So being on the other end of it and getting the social services is kind of a strange place to be. My calling is now to go back to being the old me. And now that I've been through this, I can personally say I know how you feel. I know I can help you. It shouldn't matter if you have a job making $300,000 a year or somebody on disability that's making $1,200 a month. We should all be treated equally.
We know Medicaid expansion is vital. And I'm talking about full Medicaid expansion. And I'm not talking about medically needy share of cost Medicaid, where you have to meet a $1,500 deductible every month before your Medicaid benefits even kick in. And we know that a healthy society, physically healthy society, feeds back into the economic strength of a society. So sometimes Medicaid expansion isn't taken on by a state because they're worried about the economic impact. But if your citizens are healthy, then your citizens can work and they can pay taxes and they can do other things that will make the whole your whole society healthy. You know, the insurance companies waived co-pays for COVID treatment, some of them did, and COVID testing. And the federal government made a huge deal about this, and those people with insurance greatly appreciate it, but it did nothing to help uninsured patients. So we've got to expand Medicaid, and I'm talking about expanding full Medicaid to persons that are uninsured and cannot get health care otherwise, cannot get health insurance otherwise. Medicaid expansion is vital. I don't know how we beat down this door to get this done. I don't understand how people can sit in the State House and look at your neighbors or the people that are working around you and know that they don't have access to health care because something as simple as using the federal funds that are already allocated to the state hasn't been done. I don't understand it, and I'm sure there's somebody that can explain it to me, but I'm not one to waste money, and this was a true way. You know, sometimes I look into the eyes of folk, and I speak with people, and Dr. Bailey will appreciate this. I get this look of, well, Medicaid is for them and those, until they become them and those and realize, oh my goodness. I had some patients when the Obamacare first rolled out, and I'm going to quote her in her vernacular. I don't want no Obamacare. I don't want no Obamacare. Then this lady had a heart attack and needed a quadruple bypass and various other things. And while she was in the hospital, the case managers at the hospital realized that she could qualify for Obamacare. The hospital wasn't going to incur all of these expenses, so they signed her up for Obamacare. Yep. When she got out of the hospital, stitches hadn't even healed. She came to me and said, I thought I didn't want no Obamacare. I'm so glad I've got Obamacare. This virus is not going to just sit on one community. It's not just going to hit them and those. Them and those are taking care of you and yours. And it's a virus. And if I can get it, you can get it. And they say rising tide lift all boats. But I say if you can help one person, just like one person getting COVID can exponentially spread it to 1,000. If you can help one person, you can exponentially help 1,000 people.
My name is Sarah Stumbar. I'm a family physician by training. I actually train specifically in family and social medicine, and social medicine is the idea that in order to treat patients, you can't just treat their medical conditions and their physiologic problems, but you also have to treat and look at the communities that they live in. So if you're treating someone for diabetes, you need to consider the food stores that they have available to them and the resources that they have available to them to buy healthy foods. And so kind of as a part of that, I've always been very interested in urban underserved medicine, and I currently see on primarily uninsured patients on a mobile health center and in a few other standing free clinics close to Broward County and Opelika. Patients that really struggle, many who are unemployed or don't make a living wage. Many who are uninsured and fall into the Medicaid coverage gap here in Florida. So I do a lot of primary and preventive care, so cancer screenings, pap smears, referrals for mammography. We generally do fecal immunohistochemical testing, or basically testing for blood in the stool instead of colonoscopies, because it is very, very difficult to get colonoscopies for uninsured, otherwise healthy patients in Miami-Dade County. I also see patients for diabetes and high blood pressure and high cholesterol. Those are probably the most common things that we see. I do think that because my patients are uninsured, that we often see diseases that are not as well controlled as you might see in a population that has easy access to medications, where you don't have to stop taking your antidepressant because you don't have the money for it for that month, or where you are left with only kind of older diabetes drugs, which are good but often not sufficient for people as their diseases advance. Or very limited types of insulin due to the high cost of insulin. And so often kind of facing, diabetes that's a lot more challenging to manage than it would be in someone who has unlimited access to some of the newer designer drugs. Amount of work that has to go into being what we call a well-controlled diabetic. Like, I know that you can do everything right and have every resource at your fingertips the way I am lucky enough to as a physician who has health insurance and an insulin pump. And I sometimes will still wake up with a blood sugar that's 300 and I did everything right the day before. And so I am very sympathetic to my patients who don't have those luxuries and those resources, and how challenging it is for them every single day. They want to do everything right, and the world is just not working for them in that way. I've learned to help people work with what they've got and also respect that effort. And I think that really helps me connect with patients, regardless of the patient population that you see. The reason that most doctors, or many doctors, go into healthcare is that they really believe that healthcare is, I hope that they believe that healthcare is a right rather than a privilege. And we do have a structure, the ability within our country and within our state to expand that access to patients. And I think particularly now we're speaking in the middle of the acute crisis of COVID-19, and we're seeing how when healthcare coverage is tied only to work, we have, millions more people who are left without insurance. And so we really need that safety net for our patients as we start to rebuild our economy and our healthcare system, and look at what it means to be healthy again in this country. I'm privileged enough to care for a very disenfranchised portion of our state's residents, people who don't have insurance. And I've been caring for the same people for the last 5 years since I graduated from residency. And a lot of what I've learned over those 5 years is how you work with people to navigate the system and find the resources that are available, and also how to prioritize their healthcare needs. When I had patients who had insurance, you refer to specialists, you order diagnostic studies, and often for my patients, that's just not possible. And sometimes that works out okay, and sometimes it really means that people are going without what they need for months. People are anxious and depressed and concerned about what the future is going to hold. Many people who've been furloughed from work. My patient population tends to work in hotels on Miami Beach or work in event planning and as cater waiters and hotel cleaning people, and most of those jobs don't exist right now. And so that really heightens people's concerns about where they're going to be able to get food from and whether they're going to be able to continue medication. I do have some patients who buy their insurance through the exchanges and are able to do that. And I think that we will see people who are no longer able to pay those costs and those premiums as they start to have to prioritize, immediate needs like food and rent over needs that seem to feel a little bit more hypothetical, like medical needs. Just speaks to the importance of Medicaid expansion, because a lot of those people may fall into the coverage if through Medicaid if expansion were to happen.
My name is Emily O'Brien Iafredi. I live in Cape Coral, Florida, and I'm going to tell the story of my brother, Peter Michael O'Brien. People loved my brother. He was a people's person. He worked in the restaurant industry his whole life and worked in several restaurants down here in Florida. And I had no idea how much people loved him and how many lives he really touched until he was gone. So sometime in early March, we think, my brother started getting an ear infection. He knew it was an ear infection because him and I had gotten ear infections our whole entire lives. We were taking amoxicillin all the time when we were little kids. And then as we got older, we would do like peroxide or ear candles or the kind of self-diagnosis stuff that you find online. My brother did this a lot more often than I did because he didn't have health insurance. And so he would go find whatever remedy he could think of. The night of March 12th was a normal kind of night. It was the beginning of this whole coronavirus thing. And so we were texting about, like, I had just gone to Publix and we were like, why is everybody buying toilet paper? It's a respiratory infection kind of thing. And he was joking about, like, the apocalypse, Emily, like toilet paper is going to be the new currency. So, we were just kind of kidding about like all that stuff. And it was about 7:30, 7:45. And then I woke up the next morning to a bunch of missed calls from his roommates and his girlfriend and text messages. And so I called back and he was in the hospital. So they got him to the emergency room and they realized quite quickly that it was serious because he was incoherent and was kind of aggressive, but not like trying to fight people aggressive, but more like, why don't you understand what's going on with me aggressive. So they sedated him and intubated him pretty quickly. From what I hear, it was about 30 minutes, maybe 45 minutes, and got him up to the medical ICU. And he was never conscious again from that point. So at that point, we met with the doctor who was on the rounds at the ICU. And he explained in the best way that he could that it was like a once in a lifetime thing. He said that instead of his body taking care of the infection, what it actually did was just kept pushing it further in. So from the best that we can get, it infected the bones of his inner ear, which then just pushed it farther in, and it got to his brainstem. And from what we gather, whether it was actually meningitis or encephalitis, we don't really know, because I guess they're kind of the same thing. It's swelling of the brain. But his brain swelled to the point where there was no coming back. It really bothers me that had my brother had health insurance, had he not been afraid, to go to the hospital or go to a doctor, he probably would have gotten a prescription and he would have been here. And the second part of the story, kind of the prequel, is my brother had a shoulder surgery in September. He had fallen and broke the little round part that goes into your shoulder. And it was a necessary surgery because without it, he would have lost like function in his arm. Okay. And he doesn't have health insurance. And so that surgery cost him ballpark $40,000-ish. So my parents paid the deductible, which the surgeon required before they would even schedule the surgery. Or not deductible, but kind of like down payment, I guess. So it was $1,000 that my parents paid just to get the surgery scheduled. And then he was getting bills and bills and bills. And as a server and bartender in the restaurant industry, he not only lived paycheck to paycheck, because his paychecks were like $60 maybe, because he made $2.13 an hour, which is the minimum wage for restaurant workers. He was tip to tip, so he was night to night and lived based off pretty much whatever tips he could bring in. He was genuinely afraid of the fact that he would walk into an urgent care center and they would run his name and say, you owe the health system $40,000. I'm not going to see you to give you a prescription for an antibiotic until you pay me some part of that. And it was a legitimate, like, genuine fear that he would be denied treatment, not only because he didn't have insurance and couldn't pay, but because he owed a past bill. Because, you know, Lee Health in Lee County, Florida is everything. You know, they pretty much have their hands in everything. And so he was very, very afraid that they would reject him and they would turn him away. For something as simple as looking in his ear and seeing that he has an ear infection and giving him a prescription for amoxicillin, which is free at Publix, you know? And so that fear kept him from getting better, kept him from going to the doctor, kept him out of, you know, out of care. And he probably would have qualified for Medicaid had the Medicaid expansion passed, but Florida's very far behind in that. And, you know, paycheck to paycheck workers and people that are living day to day are the ones that are lost in the system more than ever. And he, like probably all of his friends in the industry, they just don't go. You know, they're just not going to the doctor. They don't know underlying issues. They don't know whether they have, you know, COVID-19 because they're never going to go for fear of these bills that are going to rack up and bankrupt them one point in time or another. Every time a legislator says no to Medicaid expansion, there's a face behind it and there's a family behind it. And, you know, I want Governor DeSantis to read my brother's obituary and have to see that, like, saying no to Medicaid expansion means that you're saying it's okay for this person to not get treated. It's okay for this person to lose his life over something as simple as an amoxicillin prescription. There's this whole myth of, you know, like, people don't want to work. People want to get money from the government. And that's why people say we shouldn't have the safety net, because it would encourage people, you know, to rely on the government. But no, people want to work. The idea that we are so worried about one or two people that might abuse the system that we let millions of people go without support is abhorrent. I mean, I just think, like, these aren't, like, this isn't the world that I want to live in. We should be taking care of people. We should be saying to moms, I get it, you want to go to work, but, like, you can't right now, so here's some help. That's why it's important that we take action now. It's time to contact our legislators and tell them that Floridians have waited long enough for Medicaid expansion. You can call 850-558-5575 to be connected directly to your representatives. You can also text MEDEX4FL to 52886 to sign the petition. We've waited long enough. Healthcare is a human right, and it is time that Florida approves the Medicaid expansion.